Very exciting day here. We have just wrapped up a whirlwind week of Nurses Week and Hospital Week. And I'm joined by Brad Morrison, Chief Nursing Officer here at Kettering Health Hamilton. Brad, what's going on?
Good morning, team. So Paul and I have a really exciting announcement. We are here to let you know that we will be replacing all of our inpatient beds in IMC, 4 main, 5 main, and all new stretchers in the emergency department.
Now, Brad, why are we doing this? Is this just for fun, or is this just something that we want something new, shiny and new? Why are we doing this?
Paul, I am so excited because the number one thing we've heard on surveys and different feedback from our teams is that we need new beds and we need new stretchers. And we do a lot of rental beds and things that just aren't what we want for our patients and our teams. So based on feedback from our folks who are working the bedside, we're bringing in all new beds with all new safety features and all new stretchers in the ED. So
Brad,
big move because we heard from our team.
That is really cool. And these are absolutely gorgeous. And Brad, these are the top of the line beds?
Top of the line beds. So we've partnered with Stryker, bringing in top of the line beds with safety features and pressure injury reducing features like low air loss, low height for the safety features. iBed connectivity, so we'll have dashboards and connect to our documentation and monitoring our bed alarms. That's the word I'm looking for, monitoring our bed alarms. So I am just super excited to be able to do this. In the ED, we'll have pressure reducing mattresses, built-in bed alarms for the ED stretchers. We've had to use separate ancillary bed alarms that just aren't very functional. So I'm excited.
So, Brad, the number one thing that our teams care about is safety. And so these beds will provide a safer care environment for our teams. They will make life a lot easier. A lot of the documentation that nurses and clinicians do into our medical record will actually configure how the bed's set up. And so you'll see here, for example, this one's green. This was configured for this specific configuration. So that way, if any event that the patient or the family moves a bed rail or the patient's not where they're supposed to be for their safety, it will automatically flag a visual dashboard. So Brad, why did we choose Stryker?
You know, Paul, Stryker is leading the industry in bed technology and safety. We've created a great partnership with Stryker. They will be not only bringing in all new beds with the technology and safety we've talked about, they have some at-risk guarantees that they're willing to share with us to reduce falls and reduce HAPIs. So really guaranteed improvement in our patient outcomes and quality.
That is really cool. And so Brad, I think this is something that the whole Kettering Health Network is looking at. Who is first in getting these beds?
Paul, I am pleased to say that Kettering Health Hamilton is leading the way. We are the first hospital in the system that have the good opportunity to bring in these beds.
So Brad, when can we expect these beds to start rolling out on the floors?
Yeah, so right now the timeline is early August. We should have the beds arriving and be able to put them into service. We're planning to have a big party team, so it's going to be a big deal and a lot of fun when we get that.
Well, Brad, well done. Congratulations, team. Thank you so much for your feedback. Your feedback directly informed the types of beds that we purchased and the need to purchase new beds. And Kettering Health Hamilton, one more way that we are leading the way in safety and experience. Thank you so much for being on the team. And Brad, I can't wait to see the training and all the stuff that's going to go on and the fun that we get to improve the lives of our patients. So thank you so much for leading this. Team, have a wonderful day. Come down and check them out right here in the lobby at Kettering Health Hamilton.